Good morning, good afternoon, everyone. My name is Hasbiela Ahmed, and welcome to the fourth and final session of the Nigerian Learning Collaborative webinar training series. We have on the line the rest of the NLC team. We have Betsy, Meredith, and Rebecca. Please feel free to use the chat box for introductions, comments, suggestions, and contribution. Betsy will be the lead for today's discussion on M&E for social norms change programs. Betsy is a social scientist with a lot of experience in global health. I think I'll just give it over to Betsy. Over to you, Betsy.
Wonderful. Good afternoon, everybody. Thank you, Hasbi. I'm going to turn my camera on just for a little bit here in the beginning so you can see who's talking, and then I may turn it off just to focus more on the content here. So in today's session, so this is the fourth and the final session in our capacity building webinar series. If you can advance the slides, Rebecca. So I think you've all already participated in the three really great sessions facilitated by Ben Chislagi on the relevance of social norms theory for health promotion interventions, identifying social norms, and identifying strategies for norm change. And now that we've identified all the strategies and what social norms are, right, we're going to think about how to monitor and evaluate social norms shifting programs today. So today's session, next slide. We're going to do a little recap of our the last webinar, which is, I'm going to turn it over to Ben in a minute to lead us in that. And then we're going to go right into monitoring and evaluation. And I know a lot of you are probably experienced in monitoring and evaluation for your programs, but so I'm going to try specifically to focus here on, what is different about doing this for social norms change programs. So what do we want to monitor for and evaluate for social norms change programs? We're going to do a few activities here. Then we're going to think about when to monitor and evaluate for social norms change programs and how to measure normative factors for M&E. And then we'll follow up with some key takeaways, additional resources, and the certificates for completing this series. So thanks again so much for joining us. I'm going to turn it over to Ben for a few minutes. Ben, do you want to go into the next slide here? We'll do your recap from webinar 3.
Yeah, thank you, Betsy. So just as a form of recap of what we discussed now about a month ago, in the next slide, we have discussed social norm change strategies, and we found that the first key takeaway of the session was that for social norms to change, it's not just enough that people change behavior, but this change must be visible. And when you have a large percentage of the population changing behavior, and then you also have a large percentage of the population witnessing changing behavior, that can facilitate social change in social norms as well, which is the first point. Then we looked at different norm strategies. We discussed laws and policies, and we discussed the example of smoking and the efforts of Antanas Mokus in Bogota and Medellin. We discussed other examples in our small groups, including examples on the drink driving policies. And then we looked at mass media as intervention strategies. We heard from Voices for Change as an example. We looked at the example of radio dramas. We looked at examples from TV episodes, TV series and films. And then we discussed normative feedback, that is personalized normative feedback and group normative feedback. And personalized normative feedback are the strategies that target people individually and send them messages about how they are doing with the behavior of interest compared to others around them. We used the example of electricity consumption, and I mentioned the example of truck drivers speeding receiving texts being told that they were going faster and using more gas than their colleagues. And then we look at group normative feedback, which is the strategy that tells people about their own community. Things like 60% of the people in this community don't drink, or 80% of people in Nigeria vaccinate their children. And finally, we looked at group discussions as effective interventions, especially in rural areas, but also in places where people's communities tend to overlap with the reference groups, as for instance in school, in the family, in a small rural village. And we also discussed how a ratio of 1 to 10 seems to be effective in terms of how many participants you have and the population that you want to reach out to. So if you want to reach out to a population of 500 people, 50 people seems to be a good number to start with in these group discussions. But if you have 1,000 people, then having 2 groups of 50 each seems to be more effective. And then finally, we discussed how strategies can be mixed, and not only how strategies can be mixed in ways that allow you to combine laws and policies with normative feedback, for instance, but also how social norms interventions are not exclusive and siloed, but they need to become parts of larger programs, so that on the one hand, you might be working on reducing stigma and anticipated disapproval for visiting the hospital in case of fistula, of a woman having fistula or a woman wanting to use contraceptives. And on the other hand, you're also addressing the material and institutional barriers, for instance, reducing the cost of contraception and making sure that the law says that women can access contraception without their husband's permission. So this is really what we looked at in the last webinar, and we will go over these again. And here's the 4 change strategies that we looked in detail. And I think this is my last slide, just checking, Meredith. Yeah, and thank you. And then at the end of the webinar, we asked you to select an intervention that you have seen, created in the past, or that you currently are working on, and just to have some brainstorming on which of these 4 strategies, or which strategy or which strategies are more appropriate to be integrated in that intervention and how. And I'd like maybe to hear from a couple of people on whether they had done this and what did they think about the most appropriate strategy. So I'll leave the floor open, and you can obviously either unmute yourself or write in the group chat. I'd like to know if you have considered interventions that you have seen, participated in, designed, implemented, and whether you have thought, oh, that intervention could have been really well paired with a social norms change strategy. And in that latter case, then which strategy do you think will be have you thought will be most appropriate? And I know it's challenging to speak in the plenary, but yes, please, who was that? Also typing in the chat will be completely acceptable. It's not against the norm. Okay, well, I guess no one feels like sharing their reflections, but there will be opportunities later on to do so. So back to you, Betsy. Thank you.
Okay, great. Thanks, Ben. So again, for those of you who are joining late, I'll just turn my video on here for a moment and say hello to everyone. Good afternoon. I'm Betsy Costenbader. I'm a social scientist at FHI 360, and we're going to talk today about monitoring and evaluating, what's different about monitoring and evaluating programs that incorporate social norms. A subject near and dear to my heart. Okay, so next slide, please. Okay, so I'm sure many of you are experienced with monitoring and evaluating your programs. And then you're in your typical monitoring and evaluating, you're looking at your strategy or your interventions and how they lead ultimately to your behavior change. And so you're monitoring your activities to see, you know, for instance, are you reaching the intended audience? Maybe an example indicator would be a proportion of the intended audience participating in your intervention activities. And then you're monitoring your behavior change. You know, so maybe an example indicator there would be the changes in individual knowledge, attitudes, or practice, right? But next slide. The elephant in the room here is, are you monitoring? Next slide, please. Are you monitoring this, the social norms change process that happens in between here? And this is the trickier thing to monitor and evaluate. So we have to ensure that we capture this process. So exactly, next slide. So in terms of what to monitor, so this is a point that Ben covered in his webinars. But when you're considering which norms to monitor, there may be multiple norms that influence a behavior. So in this example, you know, we tend to think about we think of a behavior, we often assume that the social norm that corresponds most directly to this behavior is the one with the greatest effect. So in this example, you know, we're trying to work on childhood vaccination, and we think that the norm about perceptions of parents, perceptions among parents about childhood immunization is not common, is going to be the most important norm that directly is related to how many children are vaccinated. But in reality, however, as shown in the circle or on the outside, there may be many other indirect norms which have a large impact as well on childhood vaccination. So in this example, you know, the fact that it's only normative for mothers to take their children to the clinic, or there's a norm around men not trusting modern medicine, or there's a norm around religious leaders opposing vaccination. And those things could be, you know, very have a huge impact as well on childhood vaccination. So in fact, shifting these other norms may have to occur first to have the greatest impact on childhood vaccination rates. So, so we need to think about direct and indirect norms in terms of deciding what to monitor. And we also need to keep in mind that not all norms are equally strong nor equally amenable to change when we're deciding what to monitor. Okay, next slide, please. So what normative factors to measure, to monitor and evaluate social norm change? So these are terms that Ben has covered. You know, we're going to talk about monitoring descriptive and injunctive norms, thinking about reference groups, and outcome expectancies, or the rewards and penalties for conforming or not conforming to those social norms. So next slide. So I know that the idea of social norms, measuring social norms, can be quite daunting. And now I don't know if it's indication that the field has progressed quite a bit, or just that I've been doing this for a while now. But I actually think that it's not that difficult. And there's kind of a formula you can follow when you're trying to come up with how to measure your social norms. So first of all, as has been talked about in the other webinars, if you go back for a minute, sorry, I think, first of all, you want to think about these two components of a social norm. So a social norm is both about what people are doing and what people approve of. So in your questions or your indicators, you want to get at both, are people doing this behavior? So for instance, the proportion of respondents who perceive others in the community are getting their children immunized. And then you also want to think about the do component. So the approval component. So the perceptions of what others approve or disapprove of. So the proportion of respondents who perceive that others in the community approve of getting their children immunized. So both the do and the approve. Next slide. And then of course, you need to think about, you know, what behavior of interest you're targeting here. And you want to just have one behavior of interest that you're measuring in each of your questions and resulting indicators. So this could be, you know, getting your children immunized, getting tested for HIV, using a modern contraceptive method, whatever it is, but you want to make, you know, one clear behavior of interest in your norm indicator. Next slide. And then we need really important thing that differentiates norm indicators from measurement of individual level behaviors and attitudes is that your indicators need to clearly indicate who are the reference groups, are the people whose approval matters to the behavior, and the target population, the behavior, the population of the folks whose behavior you're trying to change. So in this example, the question you might ask is, do you think that unmarried girls in the congregation are getting tested for HIV? And then your corresponding indicator would be the proportion of congregation members who perceive that unmarried girls in the congregation are getting tested for HIV. That's you might be your descriptive norms, right? And so in that example, you're specifically looking at the population that your intervention is trying to change are unmarried girls in the congregation. And the corresponding reference group, the people that you've determined whose approval really matters, who are the power holders here, you know, in terms of whether or not girls in the congregation can get tested for HIV, are the other congregation members. And so in a similar fashion, then you would do the same for approval. You would say, you know, do you think that other members of your congregation approve of unmarried girls getting tested for HIV? And then your corresponding indicator would be the proportion of congregation members who perceive that other members of their congregation approve of unmarried girls in the congregation getting tested for HIV. So you have in there both your target population and your reference group. Next slide. And then it's also important, not completely essential, but often very important to understand what kinds of, you know, outcomes. We use the term outcome expectancy, the rewards or sanctions, penalties or rewards that people may face if they conform or they don't conform to this norm. So in this case, in this example, you might ask a question of how likely do you think it is that an unmarried girl in this congregation will be harassed if she's seen getting tested for HIV? And you usually want to use some kind of a Likert scale to see changes over time, moving up or down in the scale, something like very likely, somewhat likely, not likely. And then your corresponding indicator would be the proportion of respondents who think it is very likely that unmarried girl in this congregation will be harassed if they are seen getting tested for HIV. So the harassment is this outcome expectancy that we want to find out about. So next slide, please. Okay, so as a recap, your social norm measures either the descriptive norm, the perceptions of the typical behavior, or the injunctive norm. Do those separately. And really you want to do both. You want to understand the typical behavior and the perceptions of what is appropriate. You need to make sure that it refers to one specific behavior and that you've clearly defined who the reference group is. Who are the people that influence this behavior, whose opinion about the approval of this behavior matters in this social group. If you don't have that in there, it's just that you're just measuring an individual attitude. And then you also want to refer to a target population and make sure that your target population is what the target population that you can actually intervene upon for your program. So don't bound it too large of a population that you can't actually, you know, you're not looking at all girls in the country, you're looking at girls, specifically unmarried girls in the congregation. And then it's also good to determine what are those rewards or penalties that would follow from engaging in this behavior. So I'm going to pause there for a minute and see if there are any questions about that formula that I just went through. Is that totally clear to everybody? We're going to actually do next, we're going to do a little activity to kind of reinforce this formulaic approach to social norms measures. But are there any questions at this point? Great, totally clear, huh? Okay, good. Okay, so next slide, please. So here is, so this is hypothetically we're going to think about a situation where you have a colleague who's wanting to monitor and evaluate social norms in their program, and they came up with these questions for their survey, their monitoring survey. And we want to offer them some advice on why we don't think these questions maybe are ideal, or what we can do to change these measures to make them better. So I'm going to give everyone like 5 minutes, and there's no right or wrong answers, and there's probably multiple different answers for these different questions. But maybe to go through each of these questions and think about ways that you could change these, improve these survey questions, and what you think might be problematic about them in terms of capturing the social norm. Does that make sense? Any questions about that? Okay, great.
Sorry, are we to look at all the questions, or are we just to pick one?
Good question. Good question. I think there's time for you to look at each of the questions and just jot down a note or two about each question. You know, maybe it would be a way to phrase it that's improved, or what you specifically see as the problem with the question. But I think there's time for us to talk about each of the questions. So
Okay.
again, no right or wrong answers, but yeah. So again, I'll just reiterate as you're doing this, there's no right or wrong answer. Just go through each of these questions and just give some thought to how you might improve the wording of the question, or what you think might be problematic about the question in terms of being able to understand the social norm. And then in a minute, we're going to open the mic up, and I'm going to ask for volunteers to kind of talk through each of the questions. And there's probably, you know, there's no right or wrong answer. There's multiple things we could say about each question. And I see in the chat that Mustafa just joined. So hopefully welcome Mustafa, and hopefully the directions I just gave again are helpful. We're going through each of these questions and trying to think about how we might improve them to help us to measure social norms, and what might be problematic about them, you know, as they're currently written, that would make it hard for us to measure this underlying social norm.
Okay, thank you. I think the instruction is helpful. I will participate.
Wonderful, thank you, and welcome.
Where is I said you should give me flash.
Okay, and so I see people are putting some ideas into the chat box. I'll just give you another minute or so to write down some thoughts, and then we can talk through these together. Okay, are people ready to chat or do you need another minute? Thumbs up. Anyone need another minute? Okay, so I see people are still posting things in the chat, so I think people are still working through these. So I'm going to give you one more minute. Okay, great. A lot of comments going on in the chat box. So let's start with the first question. Who would like to read their improved question or give some thoughts about the first question and what could be improved? And again, no right or wrong answers here. And I see there was, I think Maulid has a raised hand. Go ahead. I'm not sure if I said your name correctly. I apologize if not. Go right ahead.
No, it's all right. My name is Maulid from Chief of Office for UNICEF Kano, and I'm currently in Maiduguri, also heading the Maiduguri office for UNICEF.
Wonderful. Thank you.
I like the questions, especially the first question, but I would think of instead of making it directly, I think it's good to ask like third party kind of a question, and make what do communities think of teenagers using contraception, or what do your friends think of? Because when you ask, do you think, some people might think that is reflective of her or his opinion, and I sometimes see people who do not want to answer the question directly and state their views, but would rather think what others think of, and it implies that's what that person also seems to think is the right way of looking into.
Great, good points. So you're correct. We talked about the questions that get at the descriptive norm and the injunctive norm, the do or the approve, and this is kind of a little bit in between, right? It doesn't really ask about either directly. I think if we wanted specifically to get at the do, we might just ask, do teenagers, right? And then if we wanted to say and then the approval would be something more direct about do others approve? I think another good point you bring up here is typically and what's missing from this question, and one of my is that we would want to ask, about others' perceptions, right? Do others in this community approve of this behavior? Anyone else have some thoughts about this question? There are a few other things I wanted to mention, but does anyone else want to?
Hello.
Go ahead.
Yeah. To me, taking into consideration the other comments is, do you think is sort of close-ended, and that restricts the information one can potentially get? So I'm wondering if you say, do you think, or it will be like either yes or no, and that closes it. And I'm wondering whether we could ask, what is your perception or understanding of the use of emergency contraceptive amongst teenagers?
Yeah, that's a great point too. And so I think, and we talked about previously when I was talking about the formula for developing social norms measures, that we want to kind of, for a lot of the quantitative measures, we're trying to get more at a prevalence. So it may be more useful than to phrase it like how likely, and then have a scale so we can see over time whether that scale is improving. But then also if we're using this maybe as a more qualitative measure, then you exactly leave it open and a little more open-ended, like you were saying, to let people really fill you in on their thoughts, right? As opposed to this kind of, you know, yes, no, which is limiting in terms of how much information it gives us. There's one other concern I have about this question. I don't know if anyone else wants to make a comment about these questions. These are all good points that are being raised. So.
Okay, can I go again?
Sure.
I think there is an assumption in the question, and the assumption is that the person or the respondent understands what is emergency contraception. In our setting, I believe a lot of individuals do not understand, depending on who may be the respondent, understand what is emergency contraception. So, or they don't call it emergency contraception. So if this lack of understanding or assumption that they understand what is called emergency contraception could also be misleading. And I don't know whether there should be a question that will explain what emergency contraception means before the question. Over.
No, that is a great point too. Great point, exactly. Don't put a behavior or practice in there that people might not understand what it is, right? So yeah, exactly. If you're going to talk about emergency contraception here as the practice, then you probably would need to have done a lot of preliminary work to explain to people what this practice is that you're talking about. So that is another really great point. Absolutely.
So I have a short one on question 1, please.
Sure. Yes, please. Go ahead.
Generally, you know, emergency contraception, discussing it in like my environment here it's quite a sensitive subject because basically the notion or the perception on emergency contraception is twofold. One, to avoid, you know, getting pregnant when not prepared, generally unwanted pregnancy. And the number one route that people think is when there is premarital sex. So there's a huge tendency that people will lie about this in this environment because they may want to hide, you know, their social or whatever living. So I don't know how easy it is actually to discuss this with people around this environment.
That's another great point. Exactly. You need to be thinking about your contextual environment and whether, you know, how open people are going to be about the subject. Again, one of the things that's often nice about asking about social norms is that you don't put it in the, you know, you don't make it personal, and you ask them about it in the setting or context where it kind of, they're one step away from it. And so they feel a little bit more comfortable responding about it. And so one of the big things I see missing from this question is we're asking about most teenagers, but we don't, you know, specify or bound where those teenagers are in a clear way for interpretation of this question. So, you know, in what setting, in what context, you know, are we talking about the teenagers who go to this school, who, you know, who attend this congregation, who are coming to this family planning clinic? You know, again, we talked about the, you know, the way that this is phrased, we don't really get at a likelihood or a frequency, and we don't really get at clearly whether we're asking whether they're doing this or that people approve of it. So and then this issue with emergency contraception being maybe not clear what it is and maybe a little bit taboo in that setting. So there are a number of issues with this question, you know, in terms of us being able to use it to get at the social norms around that. How about question number 2?
Well, for question 2, if I'm going.
Yes, absolutely. Go ahead.
Yeah, I think the question is double-barreled. You have included friends and religious leaders. So I will suggest the question be split into 2 so that you exactly know that the answer you get is related to only a particular a group, either your friends or religious leaders. As it is, if somebody answered yes or no, then you are left with to whom is he making reference to? Is it to the friends or to the religious? So I think it's better to split the question into two.
Yes, excellent. I would totally agree with you. And exactly, that's the point that I wanted to make here. I think this would be difficult to translate then if you get the answers, because then you're saying that you've asked about friends and religious groups, so you don't actually know which one they're referring to. Let's say they say, you know, many. Well, is it many of their friends, many of their, you know, or five? Is it five of their friends, five of their religious leaders? So this is a really problematic question as phrased. So I would definitely want to break that up into more than one question. So for the interpretability and usability of that data. Excellent. Any other thoughts on this question that people wanted to share?
Hello, good afternoon. If I may come in, please. I also agree with what the previous person just said now. It doesn't define their target audience. So I think rephrasing the question to probably directly to the religious leaders, say a question thrown to the religious leader saying, do you vaccinate your children, would be able to populate a better data for that answer. Thank you.
Yes, totally agree. Great.
So in addition, I think it's always nice to have rates and percentages when, you know, trying to ask generalized questions like this. If, for example, you ask me how many of my friends, I may say many, but I may say 10 of them. So what does 10 mean? I might have 1,000 friends, or I might have 11 friends. So we need to relate the number or the quantity to something, you know, except if it's just descriptive and we want to find out if it's just many or a few or maybe 50-50 kind of answer.
Yes, this is a good point you raised as well. And you're thinking about how you're going to use this. The likelihood is for most of these questions, what would be useful, as I touched upon a little bit when I was showing the measures, is to have some kind of a Likert scale response so that over time you can see if that Likert scale is improving. Because you're right, if you left this just as an open-ended and they can give you a number, that number may be very hard to translate, because you're right, one person may have, you know, 100 friends, the other person has 2 friends. And so if they both say 2, you don't know if that's 100% of their friends or, you know, 2% of their friends, right? So probably here what you want to do is to pair this with some kind of a Likert scale, because what is probably relevant or important in terms of social norms is their perceptions of the prevalence in their social circle. And so what's important is the magnitude. So they think that many of their friends, and so you'd probably want to do you know, or they think most or what of their friends or whatever. So you do some kind of a Likert scale, and then again, to assess change, you look at how that Likert scale is changing over time. So that's a great point. How about question number 3?
I think question number 2, one more dynamic.
Sure, absolutely. Go ahead.
So both the age group and gender dimension for both the friends and the religious would also make much more.
That's a great point too. Absolutely. Absolutely. Yeah, that's another great point. Exactly. Maybe your friends aren't a monolithic, you know, group, right? And there's some differences between your male friends and your female friends, and you know, exactly the age range of your friends and or the age range of the children that you want to ask about. You know, how many of them would vaccinate their children that are at, you know, between this age and this age. So giving more specificity to a question is always, you know, useful in the interpretation and thinking about how to translate that into your program. So that's a great point as well. Yes, sorry, super great point. Any other important points about question 2 before we go on to question 3? Okay, great. Those are all great points. How about question number 3? Who has some thoughts on question number 3?
Yes, good afternoon. So question number 3, I would quickly want to confirm, is the question targeted at girls alone? Because it's saying, among girls you look up to, do you think most wear face masks? So are we looking at just girls as the respondents for this question? Second, I think if you're looking up to someone, most likely you see the person as often as possible. So do you think here does not really correlate with what you see? Do you see the person wearing this face mask as for the most of the time, or are you just thinking the person is wearing the face mask?
Yeah, great points. There are a lot of ways this question could be improved, right? I mean, so with a visible behavior like that, exactly, we don't need to ask necessarily, you know, we could ask just, you know, are they doing this? Do you see people doing this, right? But also this question about girls you look up to, you know, what is that group? Is that in what community? You know, we look up to them because of what, you know, what characteristics? So it's kind of a, yeah, it's a vague question. What other thoughts do people have on question 3? Other issues people identified with question 3?
I hate to keep on coming back, but I think, as you rightly say, the context is important. The socioeconomic factors are also important. The categories in terms of education and whatever level people have are also important. So a question like this would need to also have a scale like the other one, so that we know what we're talking about.
Yeah, a scaled response would be great. The other issue I was going to raise with this question is that, you know, we say wear face masks. Well, I think that that's a kind of behavior that we would want to put some specificity to that. So, you know, wear face masks where? Every time they go out of the house, under what circumstances are they doing this behavior? Because we probably, you know, when we think about trying to intervene on this behavior, we're probably not trying to get people to wear face masks, you know, all the time in their homes or whatever. We're probably trying to get them to do this behavior, you know, under certain circumstances in certain places. So we need to maybe put some more specificity around that practice or behavior. Okay, how about question number 4? Someone want to give us some thoughts on that one?
On number 4?
Yes.
Is it a question?
Yeah, that's right. It's a good question. I should have put a question mark at the end of it, but exactly. I've seen questions like this on surveys, I would say, though.
Oh, yeah. I think if you are using like a scale, it fits in well. The only problem with that is that you have put in 2 things: if he smoked or drove a red car, which are two different things.
Exactly. This one is hugely problematic. Like if you got the responses to this, what would it tell you, right?
Yeah, okay.
Yeah, so super, and I agree with you. Yes, I see your point. 2 questions in one is just a statement. I suggest separation into 2 real questions. Absolutely. So family members might be useful and you have the approval in there, but if they, you know, if this were phrased more as a question, do my family members approve if I smoke or drove a red car, and you get responses, you don't know what that means because those are 2 distinct behaviors. So always remember to limit to one, you know, specific, clear behavior that people understand. Okay, great. This is great. How about question number 5? Thoughts on question number 5?
There's no problem whatsoever with question number 5.
Really? I'm not sure the women will say the same thing.
Are you sure of that? Are you sure of that?
Give me.
It's like
that was a joke.
That is subjective question.
I got that.
I disagree.
Yeah.
Well, I would suggest if it's a question, it can be rephrased, something like, should a woman argue with her husband, even if she does not share the same view with him, even though that in our own context here, like in the northern Nigeria, even though it's not been specified, I'm not using it, I'm just using it as an example. The orientation and other things is affecting the thinking and judgments, especially when it comes to things like this. So I would suggest the question be rephrased so that it will not be like a statement, and it will be a little bit negative to the real world.
Yeah, that's, go ahead. Mm-hmm.
Okay. My suggestion would be like a question asking of the opinion of the respondent, like saying, in your opinion, do you think, rather than just making a blanket statement?
Yes, yes. Both good points. Other thoughts on this question?
Yeah, Maulid again, is surprised. We've done a multi-indicator cluster survey, and a lot of the questions that you would never think people would answer or respond positively, including questions of this nature that eventually would lead to domestic violence, what some traditional communities approve of. So a question like this should be, how do people see, what percentage of the people would think arguing with the husband is acceptable or not acceptable, and I think this question can itself, because it's a subject that's extremely powerful, could become a questionnaire of its own, not only one question. And then if you look at different angles, you can create multiple questions out of this one. So break it into smaller pieces, different target groups and different socioeconomic groups and urban, rural, and a lot of other different groups. It could become a big debate question.
Yeah, good point. This could be broken down. We could do a lot of, making this more specific to different groups of this question. This question needs a lot of refinement, right? I think, yeah, it's very general, exactly. And then I think the other thing that we want to think about with this is one of the things, again, when we're trying to get at social norms as opposed to we're not trying to understand individual attitudes. So if we asked someone on a question, this specific question, do you agree with this statement? That would tell us about their individual attitude. And it's a sensitive issue, right? And so one of the benefits in some ways about, social norms, or what makes them easier sometimes, is that we ask them in a impersonal way about the community that they live in. We're not specifically asking for their whether or not they agree with this, but you'd want to bound this around in the community or the area where you're doing your intervention. So how many people in your community do you think would agree with the statement like this? And then you'd have some kind of a Likert scale, right? So again, it's not about, you need to bound this in a social space, and it's not about their specific opinion, but what they think, the perceptions of what others think, right? So this one needs a lot of refinement as well. So great. Y'all had any other thoughts you want to share? Okay, that was great. Thank you for all the feedback, and hopefully that reinforced some of these ideas about social norms measures. So let's move on. A lot of great feedback on that. Thank you. So let's move on. So another important point when we are measuring, when we are monitoring and evaluating social norms programs, is that, this table is to illustrate norms are complex. So if you want to monitor norm change, this doesn't happen in isolation. And there are other things happening in that social space that we need to keep an eye on as well. And some of these may be, more or less amenable to including in your activity-based monitoring systems. But what is important to take from this slide are there are 4 category areas that we think about that are useful, right, to be thinking about when you're monitoring norms change. So the normative factors themselves, which we've talked about, you know, the descriptive, the injunctive, the outcome expectancies, the intention for outcome expectancies, sometimes you want to look at. But then you also want to be thinking about changes that might be happening in the social support and social networks, peer communication, spousal communication, support for this behavior change, other contextual factors that may be changing that are important to get a sense of: the gender and age of the target group, the decision-making power of that target group, the political economic situation of households and community, the capacity of community to absorb social change, and then other social changes that may be going on. So diffusion in the exposed and unexposed groups, evidence of other collective change happening. So social support networks, contextual factors, other social change, these are all things that, in addition to normative factors, we want to be keeping an eye on when we're monitoring and evaluating social norms change programs. And in the next slide here, we see an example of a conceptual framework for norm change monitoring and evaluation. This is taken from the ACT framework, which is a M&E model for measuring change around female genital cutting. And as we see here in this conceptual framework, they are looking at the descriptive norms, the injunctive norms, the outcome expectancies, but then they're also looking at, you know, individual and social change. You know, what other things are happening in the community, what other things are happening with individuals. So we have all of that in our monitoring and evaluation framework. Okay, great. So that is the what. And now let's think a little bit about when to monitor and evaluate for social norms change. Next slide. So, so as with any kind of, you know, program where we want to look at change, for change we need more than one time point to assess change, right? So, and ideally multiple time points. So you want to really get your best measure of change, you'd want to do a before the program, a baseline, and an after to see the difference, you know, pre-post, baseline, end line. But in addition, measuring at multiple time points helps increase the chance that you'll detect a change, and it gives a better idea of the size of change, the sustainability of the change. You know, if you measure too early, the change may not have happened. Too late, a change may have occurred that went away. Measure only once, you won't know if it's continued to increase or decrease. So this is particularly important to think about for social norm change and to be thinking about during your program planning. Next slide. So this question comes up a lot in social norms work. You know, how long might it take for norms to change? And unfortunately, I don't really have a concrete answer. This is a big unknown. But I would say that we know it takes time to shift attitudes, and we know, thinking about diffusion of innovations and tipping points, that it will take even longer to change the attitudes of an entire community or society. So, and I know from my work in this area over the last few years that there's, this consensus from programs that are doing this work and evaluating the change that, you're not necessarily going to see a change in norms over the course of your project, especially if the time frame is quite short. So, so that's to advocate for longer time frames if you can, but also, sorry, to be monitoring things that may change first. So attitudes typically change faster than norms, which are a little bit, so monitoring your attitudes over time and seeing some changes in attitudes may be a good, sign that changes in norms are soon to follow. So monitor for those. And again, this point about collecting data at repeated points in time is really highly recommended, especially for social norms programs. Okay, next slide. Sorry, sip of water here. So depending on where you are in your program, you will want to you may have maybe a different purpose that you're trying to achieve with your data collection, and therefore there may be different methods that you would use to try to understand the social norms. So for instance, ideally, you'll want to do some formative research prior to the beginning of your program in order to identify what the possible social norms are in that social space. So what are the sanctions, what are the reference groups? And to do this kind of data collection, you may want to start with like a literature review, some informal discussions in the community, you know, discussions with key informants, that kind of thing. Then at baseline, you'll want to verify that those social norms that you identified during your formative are there. You'll want to assess the strength of those norms, identify potential places, cracks, you know, places that opportunities where you could intervene on those norms, opportunities for interventions. So here you may want to use some quantitative surveys. Qualitative approaches also lend themselves well to this. So qualitative interviews and/or vignettes in a focus group discussion format. And we'll talk about vignettes again in a minute. And then during monitoring, one of the important things for social norm change that we are concerned about is we want to make sure that there's no backlash, there's no unexpected results that are going in an opposite direction of what we intended, which could happen when we're trying to, you know, go in and change things that are critical to the social context, right? So you want to be monitoring for that. You may want to do some kind of activity monitoring and observation throughout your program to ensure that to watch for that and see what else is changing. And then finally at end line, you again want to look for those changes in the social norms, and you want to correlate that with your changes in behavior and attitude. So at that point, you want to probably do some quantitative data collection, as well as potentially maybe using some qualitative methods to make sure to confirm your understanding of what's going on. Okay. Okay, next question. So let's discuss at this point. I'm interested to know where you are in your programs. You know, what methods, what stage are your programs in? What methods could you or have you incorporated into your programs? So I'd like to take a minute and hear from all of you. Go ahead. So have any of you used some of these methods, and where are your different programs right now? Which stage in these measurement moments are you in? And thinking about that, maybe, you know, what kind of methods could you or have you incorporated into your programs? And don't be shy. There's no right or wrong answers. I know that you all have lots of good thoughts from the activity. You all had lots of great input. So I'd really love to hear a little bit more. This is my opportunity to learn from you.
Okay, so let me let me try this.
Great.
Yeah, so generally we provide primary healthcare services for the people of Kaduna State, and I think the major, I know the major source of payment for healthcare services still is out of pocket. So a lot of interventions now in the country are coming up to reduce this. One of which is the contributory health scheme, the health insurance. Now, before we conducted or we rolled out the program, we did like a readiness assessment to look at a few things, socioeconomic. You know, in areas where predominantly there are Muslims, insurance seems to be frowned on. Kind of there's some religious issue that Muslims have with insurance. It's why we actually even call it contributory health scheme now. We don't call it health insurance scheme. So this readiness assessment we did as a baseline, first to see what people understand about contributory health scheme as a whole. Second, to see whether people can afford the premium that we are going to set for the scheme. Third, if they can afford it, will they be willing to enroll on the program and pay for it? So as a baseline, this was what we did. In fact, we went as far as even estimating how much are people willing, you know, to pay for the premium per family per year and stuff like that. On this, we used a lot of methods. We used a lot of data, quantitative, using the National Demographic Health Survey data, using our DHIS to see general facility attendance and health seeking behavior of people, so we know what to budget for. And then, of course, the qualitative part was actually going out to the field, doing focus group discussions, asking questions. So we've started and we are enrolling. So part of our monitoring is actually to, biannually, to go out, you know, and ask these questions while we monitor the number of enrollments that we have per month, whether these are increasing or not, and then categorizing these enrollments by maybe formal and non-formal sector. In the formal, in the informal, is it informal, organized, or just normal, or just informal, and so on. Our plan, we don't hope there's going to be an end line to this. So our plan is actually to do this by 6 monthly, and then the end of year evaluations, to continuously see how people's perception is changing on contributory health scheme and whether they are enrolling or not. Sorry, I talked too much. I don't know if this makes sense to what we're talking about.
No, that's fantastic, and clearly you've done a really rigorous, you know, robust methods. You know, used a lot of different ways to collect the data. So that's impressive. That's great, and I think there's a lot of opportunities then in your different measurement moments then to build in some questions about perceptions, so maybe some qualitative discussions about perceptions, et cetera. So I'm very impressed with all that you've done, the different methods that you've used to collect your data at multiple points in time. That's fantastic. I don't know if there may be...
Adam has his hands up, I think, unless that was just Adam talking.
Okay, great. Is there... Go
ahead. All right. Good afternoon. My name is Amal. We are using the same system with Adam. So we've been working on a data quality improvement project that's been implemented by AFNet. And before we started the project, what we did was that we conducted informative research. And we used the human-centered approach to find out issues responsible for poor data quality in Nigeria. This was done in 4 states. And based on the findings we got from the formative research, we used it in the implementation of the intervention. Currently, evaluations are ongoing. This will be going on frequently. And then at the end of the intervention, we intend to conduct an end-line assessment. Thank you.
Thank you. This is really interesting to hear about the different things that you're doing and the different designs you've used. And yeah, human-centered design I don't have up there, but that's a really a great approach to use, especially at early phases, right? To get some input from your target populations on the design of your intervention. So this is great to hear that you're developing some really, you know, robust kind of measurement plans around your programs. I think in the interest of time, I'm just realizing we should probably move on to the next slide, but thank you for sharing. So this graph is just a quick graph to illustrate the importance of measuring, both measuring multiple factors and at multiple time points. You know, so for instance, if we see here, if we'd only measured at time 2, we would not have detected any change in norms, right? And that over time, you know, by the time they're able to measure at time 4, they see a lot of more change. in the behavior and in the norms. We also see that, in this hypothetical scenario, we've got migration, and let's say in this area there's a lot of population migration going on. So they fortunately collected information about what was happening on that as well, and they're able to put that into their M&E plan and see how that's changing over time, because that could obviously have a big effect on the social norms. So this is just a graph to illustrate the importance of, we have to collect data, multiple factors at multiple time points. Okay, let's talk a little bit about how to monitor and evaluate. So this slide is a lot here, and I don't want us to get overwhelmed. We're not going to go into a lot of this in detail, but this is just to say that when we think about, these are some broad categories of how we approach monitoring and evaluation for social behavior change programs. And that's just to say that, using any of these approaches, we can incorporate measures of and monitoring of social norms in there. So, the previous example someone just gave, right, about they were doing some stuff about costs, conducting a cost analysis, is not unique, but different general procedures can be, you can also look at the social norms using that kind of data. So there are pros and cons of using different evaluation designs. Each can be utilized for social norms change, and we're going to try to focus on what's unique for how to monitor and evaluate social norms. I think that's, yeah. So next slide. So how to measure normative factors for monitoring and evaluation. As I said earlier, yeah, there are single item survey questions we can use. There are scales and indices, and then we'll talk a little bit about vignettes as well. So as we went over a little in the what, we can, for single item survey questions, these are doable, don't be intimidated, and we can use the checklist of components. Is my question asking about the do and the approve? Is it asking about a specific behavior of interest? And am I clearly specifying who the target population and the reference group is in my question? And then I would encourage, as much as possible, that you select and adapt survey questions that have been used elsewhere, right? It gives you a head start, and then it starts to create some comparability in the data that's out there. And then an important thing with social norms is that we really can't just ask one question. We need multiple questions to get at these different aspects of this, unwritten, unspoken, phenomenon, social phenomenon. So we need more than one question to really understand what, its existence and how it's changing. So next slide, rather. So here are some examples of questions that have been used on other surveys. So this is a question that was used in a study, the Parvatan study conducted in India, and they were looking at girls, trying to intervene around girls' ability to move around in public spaces. So here's the question that they asked about sanctions. So they asked girls, if you're given more freedom to move about in public spaces and play sports, how likely is it that the following consequences might occur? So here they're trying to get at the different, in this case, punishments or sanctions that could occur to girls if they were to move about in public spaces. And the responses are very likely, somewhat likely, and not likely. And the questions were, the response choices rather, you will be harassed by local boys or men. You may encounter more arguments or conflicts with your parents. You may find it more difficult to get married, or you may be considered uppity and disobedient. So that is an example of a single item question for outcome expectancies. Next slide. And then in terms of, we talked about the importance of incorporating reference groups into your questions. And once you get down to a specific question, not incorporating more than one, but we also know that those who matter to different behaviors may differ in different communities, and we need to kind of tease that out first. And there are different approaches to doing this, right? So here's a question that was used study in the DRC, and they asked about, so they first asked the question of, so in matters related to family planning, whose opinion is important to you? And they gave people this list of all the different options of people that may be important to them, you know, from, you know, spouses, relatives, etc. And then they asked a separate question about, so not only about people's whose opinions are important, but whose permission would you need? Who are the real power holders in this behavior? So if you wanted to use a method, would you need anyone's permission? And they tried to find out who that person was. And then they can build those reference groups into the questions. So those kinds of, that method is one method to get at the reference groups and power holders. Next slide. Next slide. And then another way to do this is to kind of map the social networks of people. So this was taken from a project conducted in Benin by the Institute for Reproductive Health, where they did this social network mapping census, right? So they first did this exercise where they asked people, they said, now we're going to talk about the people in your network, people you interact with, people you receive support from, people you consider to be part of your world. So kind of a broad definition of the entire network of people that the respondents may be interacting with. And then they asked specific questions about each of the people named. So, you know, so if the person named Tom, then they said, okay, what is your relationship with Tom? And then they said, does Tom live in your household? Have you spoken with him about this specific method? In this case, in this specific behavior of interest, in this case, which was birth spacing, or a method that would allow you to delay or avoid pregnancy. Would you say that Tom approves of, you know, using a method of family planning to space births? And would you say that Tom uses a method of family planning to space births? So you get quite a bit of information about each of the individuals in that network and their opinions and their approval and disapproval, as well as their own behavior, and you can then aggregate that up. So that's another method for getting at these reference groups and power holders. And then, you know, I put in this slide just to emphasize again, you know, kind of a point that I'm sure you probably all are aware of, but, you know, when we're talking about these different survey questions or measures of social norms, we use a survey question, you know, and like usually maybe a Likert scale, but then we have to take it another step to get to our final indicator for monitoring, right? And so this case, here's, you know, 3 questions that were used as an index. They added all the scores together, and then they ended up with an indicator of perceived prevalence of FGM. Or on the bottom, they had 5 questions that they used, and they added those up to get a percent. They only used the people who responded, who gave a certain response of abandon to all the questions, and then they added those up to get their indicator. So you need to think through not only what your questions are, but what kind of score or cutoff will you use as an indicator that you're for assessing that norm. Okay, and then another thing that's useful to do, we talked about how, you know, attitudes often change before norms do. So it's maybe useful to, you know, include some questions about individual attitudes on your survey. Here's a survey that was done. I can't remember where this one was done, but and where they asked, you know, I want to understand the levels of approval or disapproval. And they asked girls, can you tell me what extent you and other girls like you approve or disapprove of the following? So do you approve or disapprove of using sanitary pads? And then do other girls in your village approve or disapprove of using sanitary pads? And looking at whether or not there's correspondence between individuals' approval and what they perceive others to approve, whether there's correspondence or discordance, can be quite useful to see whether or not norms are changing or how amenable they are to change. Okay, this next few slides are I'm just gonna briefly touch on this subject because in the interest of time, but I'm happy to you know, host other questions you might have about this. But I just wanted to point out quickly this difference in what we've been talking about so far, or are basically, when we're talking about descriptive and injunctive norms, are basically perceived descriptive or injunctive norms. In other words, they're individuals' perceptions of what others do. And this is distinct from what we refer to as collective norms, because collective norms are just the sum total of perceptions of every individual in the population. And so if you go to the next slide, the distinction here is that, like I said, for collective norms, the way that we measure them is that we aggregate within a bounded social space. So for collective norms, we could look at certain changes that are happening within communities, like social media or policies that are changing within that community. Or we could take a survey like the DHS potentially that has individual level behaviors or attitudes. We could add them all up and say that we see evidence of a collective norm. And like I said, they can be calculated as a sum of reports of a type of behavior within a bounded social space. But the challenge here is in bounding the social space, right? So we could add everything together within a certain geographical area. We could do this by, all people that respond who are of a certain age range or of a certain religion, who live in a certain administrative area or district. So and there's a lot of research still that remains and that is being done on this, because this is a really challenging area about how to bound the social space to say that a social norm exists within that area. So, this is a little bit more advanced, but I just wanted to kind of share that idea with you. And the next slide here will show an example. So this was a paper that was published in the Lancet that Ben was a co-author on, and that was looking at aggregated individual behaviors as collective norms, and they looked at they estimated the effects of nonconformity to gender norms or positive or negative differences between the individual estimated gender normativity and the median for same-sex school peers on health outcomes and health-related behaviors. And so what I wanted to point out here is that there's bounding that's happening, by gender, age range, geography, and activity in school. And the way that they did this is pretty cool. And I think there's a lot that we can learn from aggregating individual behaviors as collective norm measures. But there's still a lot of work to be done on this. So this is kind of a nascent emerging area. Okay. But another thing that's more proximal that we can do with our single item measures, as we said, we need more than one single item measure to get at the existence of social norms. And then when we have all those different questions, it's useful to put them together in some manner, put them together as either a scale or an index. And so the distinction being that an index just sums the values of the responses to the questions, whereas a scale goes one step further and it uses these statistical techniques, typically like psychometric testing, to ensure that all the items in the scale are related to each other. So scales are considered stronger measures, but there's a big but here. They entail a number of different steps to create. So as shown on this next slide, and don't worry, I'm not expecting you to remember all these different steps, but I just wanted to show this for illustrative purposes, that there are thought to be like these 10 different steps that are needed to be taken to create and to test your, to scale for measurement, right? You need to involve experts, you need to do all this different testing. So this is not something entered into easily. Need some serious time and expertise to do this. So another thing you can do in terms of using a scale is to take a scale that's been validated out there and adapt it. And/or, as shown in this slide, you can create an index. So here again is, this is from work done on the ACT framework, where they had these 8 different questions, and they came up with different scoring directions, and then they added them. So some of these questions were a max score of 10 per item, and then some were 1 and 0, and altogether the scores for these 8 items could be between 0 and 35. And then they came up with this overall indicator, which was between 0 and 35 with an and the average score was that, they took the average score for social norms, with a higher score in this index being more supportive of the abandonment of female genital mutilation. Okay, so let's talk about vignettes. So vignettes are kind of the new kid on the block a bit. They're becoming quite popular for measurement of social norms, because they are this guided storytelling methodology, and they can be conducted with an individual or a group. They can be done qualitatively or quantitatively, which I'll get to in a minute. And they can be communicated to respondents in many ways, a story, or they could even be like some kind of displayed in a computer program or whatever. And then they're followed by a facilitated discussion, or if you make it more quantitative, a series of quantitative discussions. And one of the reasons that they're become kind of popular for social norms is they're thought to be able to minimize response bias, right? Because there's the respondent is no longer talking about him or herself. They're just reacting to this story. And so it's a little bit further removed from them. And the importance, however, of that is that the scenarios need to be relatable. The questions and responses, more concrete, and again, if it's not about them, but about someone like them, they maybe minimize some response bias. So let's take a look at some examples of vignettes on the next slide.
Betsy, I noticed there was a few hands up. You want to?
Oh, there are. I missed that. Okay, sorry. Yep. Let me pause here and take some questions. I don't know. I didn't see who had their hand up, but if you have a question, just go ahead.
It was Josephine, I think, had her hand up.
Okay. Josephine? Do you have a question? I'm happy to answer any questions if you have a question, Josephine.
If you're talking, you're muted. You could also type in the chat box and we can, I think there she goes. Her hand is down now. So maybe, Josephine, if you have a question, feel free to put it in the chat box and I'll keep an eye on it and let you know, Betsy.
Yeah, feel free to put it in the chat box, and we're going to just take a few more slides here and then take a pause. So if others have questions, yeah, we can discuss it here in a minute. So let's take a look at this sample vignette together. So this was from a project conducted by CARE in Ethiopia. They were focused on social norms around girls, marriage, education, and nutrition. And so they put together this story about Rahima. Rahima is a 16-year-old student who lives with her parents. She attends school and helps her mother with the household chores. And one day, Hindaya, Rahima's cousin, comes over to visit, and they're about the same age. And Hindaya announces she's engaged, getting married. And she suggests that Rahima should marry soon as well. She's getting old. And she reveals that she knows someone who's interested in marrying Rahima. So then the question that's posed to the participants is, so what would most girls, adolescent girls in Rahima's position do? And what would Hindaya and most other girls expect her to do? And then what can be useful is, so you have her, the girls, the respondents, participants thinking about, Rahima and Hindaya and what they would think and what they would do. But then you pose this kind of counterfactual and you say, you give some more information. You say, Rahima doesn't want to marry young. She announces that she does not want to marry. So then what would Hindaya and most other girls say? And what would the opinions and reactions of her peers make her change her mind? And then you could find out, if there are any exceptions to these social norms, and and by asking, are there any circumstances where it would be considered more or less acceptable for Rahima not to get married at her age? And then, so if we look at the next slide, we have some of what the data that they collected, the responses that respondents gave to these vignettes. So for instance, one respondent said, father and mother make every decision about marriage. It is not acceptable that one should marry on her own wish. So this tells us a little bit about what the descriptive norm is in that community, right? In this community, what happens is that fathers and mothers make the decisions about marriage. And then another respondent said, parents make the decision in order to avoid any bad rumor in the society concerning their girl. So this gives us a little bit of insight about the injunctive norms, right? That people do not approve, right? Of girls who don't marry young, or, you know, who don't follow what their parents' decision is, right? About marriage. And then another respondent said her mother tells her that if she does, if she follows her own wishes, that the neighbors would backbite about her and would laugh at her. So this gives us some insight into terms of what sanctions would happen if the girl does not follow the social norm around following her parents' wishes to marry, right? That things people would backbite and would laugh at her. So this is what could happen to her. And then another respondent gave us some insight into the severity of these sanctions, right? And they said, although a girl has grown enough and is eligible for marriage, and she says that she does not want to marry, then we order her to stay inside the house and also order her not to move anywhere outside. So something quite severe could happen to a girl, we're finding out, if she does not follow what her parents' wishes are about marriage. But then another respondent also gave us some insight that there are some exceptions to these rules, right? That some girls do reject marriage proposals. For example, if the groom side comes to see the girl and the girl doesn't like him, she can reject the proposal. So that's some interesting insight here for our interventions, that there may be some exceptions to the rules for these social norms. So if we go to the next slide. So similar to, you know, our kind of formulaic approach for the steps that we need to follow for constructing single item measures, there's also kind of a formula that we can follow for constructing a vignette. And it's somewhat similar, except that, you know, in this case, there's a story we're trying to tell. So the first thing, again, that we want to be thinking about for constructing a vignette is, what is the behavior of interest for the story? But then the distinction here is, because we're telling a story, we need to kind of think about some of the context here in this story, a little bit more of the context, like what are the typical situations when such a behavior might occur or should be avoided, and what goes on socially in such situations, so we can really describe this context in our story. And also, you know, characters, what are the characters are typically involved? You saw in the example vignette I just gave that it was Rahima, was 16, who had a cousin, Hindaya. So they gave, you know, kind of, they tried to use names that were typical for that setting, age that's typical, etc. So what are the characters that are typically involved? And then consequences, you know, they ask these stories can ask about, you know, what happens when the main character engages in the behavior, and what happens if he or she does not engage in the behavior, and what are the reactions of others in the story. So this tells us about, you know, the outcome expectancies, the rewards, punishments, etc. And then you want to find out a little bit about the prevalence, you know, is how typical or common is this story. And then, you know, once you've constructed your story, like I said, you can make this into purely qualitative, open-ended, or you can come up with some kind of structured questions afterwards to make it more quantitative data that you're collecting. And then you'll want to think about some of the typical questions that we've talked about before in terms of finding out about what the perceptions are of others, etc., as a reaction to this vignette. So next slide. So now we're going to get in here to an activity. But before I do that, I just want to see if there are any questions on the how, on the information that I've presented on how to monitor and evaluate a social norms change program. Any questions on that section? And I think this activity will help to reinforce some of what I just went over.
Betsy, well, people are thinking, I just wanted to throw in one thought. I know this is so much information.
It is.
It's so exciting. And I just wanted to say, as we move forward next year in our working groups, for example, in our measurement and evaluation group, we can continue to engage in these and have more discussions about some of these issues that are of particular interest. So we can have more hands-on opportunities to take this content further.
That's a great idea. Exactly. Because this is a lot and a lot of it needs to be practiced and thought on, you know, a bit more than we have time for in just a short meeting today. Okay. Are there any hands up? Any questions? Okay. So as I said, this activity will kind of reinforce some of what I just went over, and some questions I imagine may come up in the course of doing the activity. So let's go to the next slide. So for this activity, we are going to use this fictional program that I came up with called Healthy Homes. And this is going to illustrate some of the points that we've gone over today. So this is a simplified theory of change for the Healthy Homes program. So Healthy Homes is this program that's using mass media campaigns, and in their Healthy Homes Plus module, they're also using healthy mass media campaigns and community health workers for the purposes of promoting knowledge, personal attitudes, and knowledge of the benefits, and ultimately positive social norms about improved latrine use. So this program is not providing direct assistance with building latrines, but another project in the area called Latrines Are Us is building more latrines, and people are hearing about those latrines at the health facilities. So they're randomizing individuals, like I said, to receive just the mass media campaign only, or the mass media campaign augmented by the visits from the community health workers who explain the benefits of the improved latrine use, right? And so they're hoping that all of this together, they will change the normative perceptions of positive latrine use, and then ultimately change the behavioral outcome of, you know, people are using latrines more. Okay, so having seen that conceptual model, we're going to break now into breakout rooms, and we are going to, if we go back, I think, Rebecca, can you go back a slide or two? There we go. Oops, go back, sorry, go back. Back to the, yeah, so back one more. So we're gonna get into groups now and discuss these 4 questions. So we'd like to have a discussion around what are some factors that may affect latrine use that Healthy Homes may want to address through their program activities? What additional data might Healthy Homes want to collect and analyze? Do any factors need to be added? When might they do their monitoring and evaluating activities, and how could they monitor these factors? And if you have time to address all 4 questions, great. If you don't, you know, understandable, but we'd like to take, I think we're going to take the next, how much time do we have? I think another like 15 minutes to discuss in groups, and then come back for a breakout. Meredith, does that give us enough time? If we do 15 minutes?
Yeah, as long as we don't need too much time to wrap up.
Yeah, I think that should be okay. So let's take 15 minutes and talk about these questions, and then we'll come back. We'd like to have for y'all to pick one person in your group to do the report back to the rest of us.
Well, Betsy, we'll only have 5 minutes for wrapping up, so maybe just, you know, report back one aha moment from your discussion.
Yes, I think that's a great idea. Report back one aha moment, exactly. Great. Okay, I think Meredith.
Okay, I'm going to send everyone into breakout. So we have a room with Betsy and Anya, a room with Rebecca and Ben, and a room with Hasbi and Paul. All right, here we go.
Great.
little while.
It's actually good. Not heavy. It's good. I don't know others, but to me it's fine.
Okay, great. Okay, so the breakout activity. So I don't know. We just have 10 minutes. Okay, 13 minutes now. So let me just read out the first question. What are some factors that may affect latrine use? Hello, can everyone hear me?
Yes, we can.
Okay, what are some factors that may affect latrine use that healthy homes may want to address through program activities? So should we? Did you get that?
Let me start. UNICEF wash.
Okay.
with the wash global with the latrine agency. No, I think some of the known factors that affect the use of the toilets are the proximity to the people, security issues, do they have lights, amenities, do they have water, are they conducive in terms of design, are they very user-friendly in terms of, are they segregated between male and female? 1,000 of these, just to start the discussion.
Would anyone like to add to that? So I'll read the question. I'll read the question again. What are some factors that may affect latrine use that healthy homes may want to address through program activities? Maulud referenced proximity, security, and differentiating from male from female, basically. He also referenced the WASH program from UNICEF. So I don't know if we have other contributions.
I also mentioned security, lighting, water availability, and all those things that make the toilet friendly, user-friendly, including the design and all of that.
Thank you very much, Maulud. Should we move on to the next question, or do we have any additions for the first question? And Meredith just posted some. Okay, so this.
Yes, Maulud has pretty much touched on every important aspect.
Yes, true. So the second question is, what additional data might healthy homes want to analyze? Do any factors need to be added? So I think we can just also reference what Maulud has said. Would any other factors need to be referenced? For me, I think.
Latrines.
Hello?
Yes, I was saying if they could maybe check if their existing latrine
is healthy. Like keeping a latrine in the house is something that is dirty. So that is actually a misnomer and need to be addressed in terms of educating them. And then two, also if, of course, there may be certain diseases, especially fecal-oral diseases that one can use or can relate to their style of easing themselves. That's not using latrine. So that's from the health aspect or health point now that one can also address that.
That's great. So any other thoughts before we move on to sort of the analysis piece? And I think, Ben, I seem to recall you've worked on some latrine projects, is that right? Some WASH projects? And I don't know if you have anything particularly social norms related that you might want to add here.
Yeah, I missed the initial conversation because I was in the wrong breakout room for some reason.
Right.
So
we're just looking at factors we're just brainstorming factors that affect latrine use.
Okay, I wonder if anyone mentioned what kind of. I guess someone must have mentioned material factors. Yeah, the availability of the materials to build the latrines. I wonder if anyone mentioned the analysis of whether the population is a nomadic one or a settled one, because that would change the type of latrine that you want to build. And nomadic populations come with a normative system, a normative set of norms by which even if you are basically settled, you should still build houses that are easily removed, and so people might be resistant to building latrines and see it as a treason to your identity as a nomadic population.
It's really interesting, Ben. I'd never thought about that. So those factors weren't brought up specifically, but they do round out, I think, our factors. So we have things about failure to, reluctance for change, the lack of perceived benefits of latrines, sort of some of the factors related to what Ben was saying in terms of perceived, that it doesn't fit well in lifestyle or your economic, your occupation, people not believing that latrines are dirty, not wanting them in their homes, material factors, which we actually hadn't mentioned, and the factors about sort of the normative set of norms related to your identity and your lifestyle. So with that, why don't we move on to our next question, which is about, which data that healthy homes might want to address to understand how well their work is going. So what kind of information do you think you would want as a program manager?
Hello?
Status of people. Are they able to afford whatever is, what do you call it, recommended? Third, location of whatever, this one is to do with the design of the latrine, what type, and in what position in the house is it going to be situated? Because I know in some cultures, they don't like their toilets or their latrines to be indoors inside the house. And so other questions like that.
Yes, those are all things that are really good ideas, exactly things you'd want to find out about. Definitely you want to find out exactly about existing practices. One of the things I'm thinking about here is that, would we want to know, might there be norms, like gendered kind of norms, gender social norms that affect who uses latrines in what locations, or whether genders can both share latrines, that kind of thing, right?
Sure. This is very important.
Yeah, that could be important to know. Any additional data that you found is helpful, in thinking about what we talked about, like understanding the larger social context, the social networks, the social change processes, any other kind of factors that you think might be particularly important to understand here? Could be important in this hypothetical scenario. I'm thinking too about the methods that the activities that they're proposing to do. They're proposing to use mass media and community health workers. Have any of you used mass media or community health workers in your programs, and what are some considerations for those?
Okay. Yeah. So for the use of mass media and of course community health workers, actually this is my line. The things we may further want to find out would be what are the implications of the current practice. For example, coincidentally enough, yesterday I represented the governor to launch a clean family campaign where we want to discourage people from, open defecation using a strategy of household engagement.
Ah, okay.
So, yes, so this is part of, I think, part of what the information we're using right now to discourage people is one, the health implication. Number two, the environmental implication. We don't have unlimited resources of clean potable water. And the little we have, we contaminate these sources, by such practices. So we look at these evidences and share them, through social media, through the community health extension workers, to try and change people's behavior to, towards, the recommended best practice as regards that particular environment. So these are some of additional information that we use.
And so being sure, I think to your point, being sure to monitor people's knowledge of those being sure to try to convey those with your program activities, and then monitor whether people are understanding those aspects.
Yeah, absolutely.
Yeah, that's good. It's good. Any quick thoughts on when you might want to do these, or how you could monitor these factors? What might be some good techniques?
Well, if I may,
yes,
I think you can use a number of methods. I'm probably using them together. One, using a kind of a checklist to collect data in terms of availability, accessibility, type, culture, and then you could also collect data on their attitude, their behavior, using a kind of Likert scale kind of a thing. But you can also use FGDs to also collect general information with respect to the practices in the respective communities. And of course, you can also collect information on individuals as well as what you have, what is basically obtained generally in the community. So what I'm saying, you could use a combination of different methods to collect both quantitative as well as qualitative data that you are actually looking for.
Yes, totally agree. That's fantastic. I'm noticing that we don't have much time left, and I'm wondering if any of you would like to volunteer to do a report back. Maybe just that's touching on the high points of what we discussed. Ismaila, would you want to do that, or would you prefer that I do the report back?
I would rather prefer you should do, because I have not taken note of some of the things that have been mentioned, and I wouldn't want to miss out anything. So I would suggest we go ahead and do the reporting back.
Okay, I will do that.
Okay,
so thank you for this discussion. Wonderful. I think we're about to go back to the main group.
Thank you.
Okay, hi everyone, and welcome back. I'm not sure, I think we'll wait a minute here for everyone to rejoin us. Am I right? We only have about, what, 5 minutes left? Is that right?
It is correct.
Oh, goodness. Okay. So maybe we do lightning rounds. Everyone say one quick high point, starting with, I guess maybe your group, Rebecca, of what was shared.
We spent a lot of time on the factors. I think there was interest in monitoring throughout, baseline, midline, and inline. And I think both sort of a qual and a quantitative perspective.
Great. How about the next group? Maybe Ben, your group?
Ben was in my group.
Oh, Ben was in your group, so not that group. Paul, how about your group?
Okay, I think Paul was in my group, so I'm just going to respond. Working group 3. So we had a very interesting conversation. It's basically spanned around security, proximity as the factors, and also lightning. We also talked about differentiating men from female toilet disabilities factors, density of use, location of latrines, seasonality, and also when it came to monitoring and evaluation, we talked about monitoring and evaluation being done always. We also talked about the possibility of incorporating the responsive feedback mechanism in the M&E part of it. Over to you, Betsy.
Oh, wonderful, Hasbi. You all had a really rich discussion, and you touched on a lot of things that we talked about as well. I think one thing I would add that we talked about was kind of understanding the magnitude of sanctions and monitoring as well, the knowledge of about environmental implications is being conveyed in the as well, understanding the location of those latrines over time, availability, accessibility, et cetera. Many of the same things that you talked about. Is there another group? Who's the other group?
I think that's it. I think
Is that everyone? Wonderful. So let's keep going. In the interest of time, I think I'm going to skip over a few of these. That's okay. And I just wanted to talk here in conclusion about resources. So as Rebecca mentioned, we covered a lot of different things. If you show the next slide, but there are a lot of resources that exist for you to follow up to get more information, guides, tools, frameworks. We're happy to facilitate your connections to all these, and there's links here to the ones that we've covered in this training. So a lot of different guides and tools exist for you to find out more. And then the next slide. I know that I've talked about this before with this group, but I would just encourage you again, both if you have a project that you want to put up on the map or to go to the map, to use it as a resource, this map which exists on the Overseas Development Institute's Align Learning for Gender Norms platform. And it's a map of the world. You can click on the world to see any programs that have been done, social norms focused projects anywhere in the world. You can also search by type of outcome that they've looked at. And what's useful too is you can see what kind of a measurement approach they use, and often they've included their measurement tools at the bottom of the summary. So that can be a useful place for you to go to be able to draw from existing approaches and to learn what others have done. And finally, in conclusion, I was trying to think about what some key takeaways are that I would want you to walk away from this with. So I boil these down to 4. So the first would be, that think about it takes a village and time, right? So monitoring and evaluation for social norm shifting programs, similar to monitoring for other things, but in particular, probably more important here, it requires monitoring multiple factors because you're trying to understand things that are the social context. And so you really need to understand social contextual factors at the same time. Because maybe if you're not seeing a change in your norms, there's something else in the social context that's changing, or that may be contributing. And super important to do this over multiple time points, because again, it takes a while to change norms. For you to walk away with the idea that no one size fits all. You can use qualitative and quantitative approaches for monitoring and evaluating norm shifting programs. And I would encourage you, in fact, to use both to reinforce different learnings, provide additional deeper insight into some of your quantitative findings, and to be more participatory. Social norms measurement is doable. Don't be intimidated by all the jargon. There's in fact some kind of checklists or formulas you can use to developing your measures. And then finally, resources exist, draw on guides and existing measures out there. And finally, I would maybe pass the microphone to Meredith, who's going to remind you about the certificates that you can receive for having completed these webinars. Thank you so much, all of you, for your time and attention today and your active participation. I learned a lot from all of you.
Sure. So Hasbiala and I are going to look back at the attendance for the 4 webinar trainings in the series and issue certificates of participation to those folks who are able to join all or a majority of them. And we are planning a second training series for next year that will be more hands-on. So I've just placed an evaluation into the chat. We just ask that you fill this out so that we can better plan for the next series and improve upon the series that we just completed. So when you open it, it's going to walk you through the September, October, November, and December webinar trainings. And so today's webinar training won't appear until the 4th one. So you'll be looking back at the 4 trainings in the series. And then we'll be in touch about the save the date for the next training series. And that's it. Thank you, everyone. Hasbi, any other closing comments?
Thank you very much, Meredith. Thanks to Betsy, Paul, Ben, and Anya, and also Meredith. I think basically the conclusion for today would be our next steps and plans for 2021. There'll be more capacity building trainings on social norms. There'll be general plenary sessions. We have TA opportunities, and we have an ongoing working group. Feel free to send me an email for more details, and we look forward to having exciting and educative discussions next year. And from me and the team, happy holidays.
Thank you all. This was really good, very good, and very, very useful training. So thank you all, and thanks for all the trainers, and really grateful for all the work you've done. Thank you.
Thank you. I'll be sharing updates of all the trainings via email and also the link. Thank you for joining.
I was trying to open the link, and just for your information, it doesn't work. It says unable to open the file.
Yes, true. I figured that out too.
I had the same experience as well.
Yeah, I would send the link via email to everyone. Just let me know if you're experiencing any problem again, clicking on the link once I share it.
Thanks.
Thank you, everyone.
Thank you, everyone. Have a lovely
Thank you, everyone. Thank you.
Thank you.
Stay safe.
Thank you. Bye.
Stay safe.
Have a great
Watch
holiday.
out the COVID-19. Bye-bye. Bye.
Bye, everybody.